Okay, so it's been August, September, October, November, December, January, 6 months or so since I last did one of these videos. I only remember that I did that last video because somebody commented on it asking about my stomach issues, which is why I'm making this video. So, like, first off, I was born with a genetic defect where my urethra, the pee hole, was too small. So I got a urinary tract infection, like, pretty much right away, like, at birth. And, and I got a lot of them when I was little. And when I was 3, I got one that was so bad that my fever shot up so high that I had a seizure and was diagnosed with vesicular reflux because, like, stuff was flowing up into my kidneys. It was bad. Anyway, there was stuff done about that, and, like, they said that I would outgrow it, and I still get, like, a lot of UTIs. I don't want to talk about that. I thought that it was related to, whatever. When I was 7, I got sick, and, my doctor said to, like, standard, like, flu stuff until, my mom eventually just, like, brought me to an ER because I didn't get better, and I was, like, dehydrated and couldn't stop vomiting, and basically, I had appendicitis. My appendix ruptured in the hospital. Fortunately, like, I was at least there, because, otherwise I probably wouldn't have survived. I don't know. But anyway, what happens when there's, like, a massive trauma, like surgery, to your, like, gut parts, what can happen is a thing called an adhesion can form, which is, check out the mesentery, Mesentery. It's a recent thing, so you might not have heard about it. It's kind of like what holds all of your innards together. Like, some of that can turn into scar tissue, like, after a massive blow or whatever. And if that happens to you when you're 7, and then you grow because you're not 7 anymore, it can cause a lot of stomach pain. So I've had, like, stomach pain my whole life. When I was 7, when I was 12, I was diagnosed with acid reflux, which got treated, and that was fine. And, like, I had stomach pain a lot, but, like, it wasn't bad enough to, like, try to get anything done about it until I was 22, when I was, like, drinking a lot and eating a lot of shitty food, and, I found out then that I, at the time, had, pancreatitis. I had a cyst on my pancreas. They didn't tell me I had pancreatitis, they just said I had a cyst on my pancreas. They said that in a year they would check it. A year later, they checked it, it was gone. They didn't tell me how that happened, or whatever, but, that can happen. You can form a cyst, and the cyst will go away. However, like, recently, I guess when I started getting prescribed ketamine, orally, I found that it not only treated my depression, but it also treated my stomach pain. And when, like, I developed a tolerance to the ketamine, like, I was like, oh, shit, what am I gonna do? Because I didn't want to ask for, like, a higher dose. And I also didn't want to be like, hey, can you also medicate me for my stomach pain? So I'm, like, I kind of let that fester until, I didn't even have a psychiatrist, and I had a seizure because I was coming down from, because I was withdrawing from, a medication I was taking too fast. And, those seizures directed me to, elevated lipase, which suggests pancreatitis again. This whole diagnostic process has taken, like, 4 ER visits and innumerable doctor visits because they just didn't believe that I was in pain. At first, the first doctor I saw said that I had a UTI, which I did, but, I also had kidney stones at the time. And then I went into the ER for the, like, pancreatic pain, which is, like, in the pit of your stomach. And, I said it was because of the kidney stones because I thought it was, and they just thought I was lying because the kidney stones were gone. Because they just, like, dissolved. Anyway, this video is too long, but, I just like I know a lot of people. I've made a lot of friends on the internet in the like chronic pain and chronic illness community, especially with invisible illnesses, where people don't believe you or they think that you're drug seeking. Especially with me, because I've got like tattoos all over me and I just don't look like I look. I don't know. Apparently, I look like a drug addict, and I'm not. Keep fighting. Keep trying to get the treatment that you need. I'm still trying. Like, apparently nobody in the state of Virginia is willing to prescribe me ketamine, so I might have to leave the state, which kind of, thank fuck. I hope I find somewhere better to live. I hope all of you out there are doing well. Stay awesome.